So today I'll be talking about 3 online programs or projects that we've developed. First one is the mobile web app, which is for our overseas trained dentists, the 8-week program. Online CPD activities with the clinical guidelines and the CLC. We've developed some online CPD activities and other online resource tools, which we've been working with, in this case, the research team, OPRAC. Don't ask me what it stands for because I can't remember, but it's OPRAC. So first with the mobile web app, it's an 8-week training program for overseas trained dentists, and the initial idea of shifting to the mobile web app and having everything online is that during the 8-week program, the students took home about 23 kilos of paper. So basically that's, in their case, if they're going back to home or whatnot, that's a full luggage load, which is crazy. So that was one thing. It's portable, it's accessible via a smartphone, laptop or tablet. No loose material. They can download all the presenters' presentations, documents and whatnot. It's with them 24/7. So basically the way that it works is access is granted via a URL link, just like any other website. Each student is given username and password, so it's specific for them only, so no external bodies can use it. And as I said, computer, laptop, tablet, smartphone, and they can create a shortcut on their phone like you would any other app that you've downloaded off the iStore. So, and this also bypasses the Apple iStore and the Android, the Play Store. And these are just some screenshots to the right. So that would be the front page once they've entered in the URL link. That's how they'd come in. And within it, presenters can have their own profiles as well. So this screenshot here, that's the home page for the app, and they're all the areas that it covers. So course outlines, basically their timetable, all their sessions, documents included. They can take notes, they can have the app up, take notes, and then have the notes emailed them back to themselves, so they've got them all stored in the one area. There's a presenter section, so each presenter has their own profile, and that the students can read and whatnot. Attendees also have their own profile, so with networking, Facebook, LinkedIn, it's all connected. Social media, polls and feedback, so we have online surveys at the end of each session that we encourage the students to respond to. A map for them so they know where the rooms are, and then we developed 2 other pages which had links to, for instance, APRA, DHSV websites, dental jobs, ADC, so a few other pages that would be of interest to them. Yeah. So that's basically that one. The other side is the online CPD activities. So it was developed with the CLC, and some of you may or may not have registered for those or done those, but basically it's accessible via our Learning Seat program, which we use at the hospital for compliance modules. It's a 2-part activity. So part 1 is the actual clinical guideline that each clinician reads, and part 2 is the online assessment. So there's a series of 10 questions that are answered in conjunction with the document. And each individual gets 1 scientific CPD unit or point, and you need to achieve 80% correct answers, and you have 5 attempts to complete it. And then as per any other face-to-face CPD activity, you get a log at the end of the 12 months, and it will list all the activities and the points granted and whatnot. So we've got 7 up at the moment. So process is it's free to all public practitioners. Private practitioners can do them. They pay an admin fee per activity. If anyone's interested, or you want to pass on the word, you think other clinicians might be interested, just send us an email, so cpd@dhsv.org.au, and it just basically listing your first name, surname, email address and the clinic, and we can set that up. So process, so yep, individuals to be registered. So once I receive that email, I register you for all of them, and then you'll receive a introductory email from myself just outlining the process. And then you'll receive a day later, usually, an email that looks somewhat like this from Learning Seed itself. And it will have all your access details, so username, password, and where to go. And you're given 6 months to complete the package, if you like. Don't stress if you don't finish it within the 6 months, they'll still be there in your account. So they don't disappear. But we initially did the 6 months because when we introduced it, it was coming to the end of the CPD cycle. So it was to encourage everyone to do them if they needed points and more knowledge. And yeah, so more information, dhsv.org.au, or the intranet for RDHM staff, or the extranet for agency staff, and just CPD page will have all the information like I've said today. Any questions on those two? Yeah, Anna?
For private practitioners,
yeah.
what's the admin fee?
$20 at the moment per activity. Yeah.
I have ex-colleagues and
Yeah.
I was just sort of wondering.
Yeah. Yep, $20. So the last project, this is very new. We've been working with OPRAC RU on their ACE MID study, so the MID Minimal Intervention Dentistry. And basically we've developed an online resource tool for them, for the agencies that are involved in the study. And similar thing, similar process to the online CPD activities, document and some questions, but their document outlines what each clinician needs to do in the study. So in this case it was to do with screening patients, and they had to look out for a certain toolbar and other information regarding it. And same thing, individuals will receive 1 CPD point on completion, and it's a new initiative, something new, and it's in its trial phases, and they're the guinea pig group, if you like. And that's it. I've sort of rushed it with the time, but that's all the 3 projects.